If you're a man over 50 and you've ever struggled with erectile dysfunction, you've probably faced the same confusing question countless times. Cialis or Viagra? Which one is actually better for you? You've seen the commercials, read the articles, and maybe even asked your friends or searched online forums. Some say Viagra works faster, others swear by Cialis's long-lasting effect. The truth is, deciding between these medications isn't as simple as picking the one with the longer ad or the flashier claims. For many men, this choice feels overwhelming, even a little intimidating, because it touches on personal health, confidence, and intimacy. It's not just about getting hard, it's about feeling like yourself again, regaining control, and enjoying your life without worry or embarrassment. Here's the tricky part. Most men look at the price, the time it takes to work, or the duration of effect, and make a decision based on surface-level information. But there's a lot more going on inside your body that actually determines how effective these medications will be for you. Factors like your cardiovascular health, metabolism, other medications, and even your stress levels can all influence how you respond. Choosing the wrong one, or using it incorrectly, can leave you frustrated, disappointed, or worse, cause unnecessary side effects. In this video, we're going to break it down in a way that's simple, practical, and backed by science. We'll talk about how each drug works, the real differences you need to know, how to use them safely, and what might make one better than the other for your specific situation. By the end, you'll feel confident about making an informed choice rather than guessing or relying on ads. Next, I'll explain the science behind how these medications actually work and why the differences matter for men over 50. To understand which medication might be better for you, Cialis or Viagra, it helps to know what's happening inside your body. Both drugs belong to a class called phosphodiesterase type 5 inhibitors, or PDE5 inhibitors. That's a mouthful, but here's the simple version. These medications help your blood vessels relax and improve blood flow to the penis, which is essential for achieving and maintaining an erection. Without enough blood flow, even the strongest desire or stimulation may not produce the result you want. Think of it like this. An erection is like inflating a balloon. The heart pumps the blood in, but the balloon can only stay full if the opening is controlled and the pressure is maintained. PDE5 inhibitors help the valves work better, so blood fills and stays in the penis long enough for intercourse. Without this support, men can struggle with weak or inconsistent erections, even if libido is normal. Now, here's where the differences between Cialis, Tadalafil, and Viagra, Sildenafil, come into play. Viagra usually works faster, often within 30 to 60 minutes, and its effects typically last around 4 to 6 hours. Cialis, on the other hand, can take a little longer to kick in, but its effects last much longer, up to 36 hours in many men. That's why Cialis has earned the nickname the weekend pill. The timing and duration are not just convenience factors. They can directly affect confidence, spontaneity, and how natural intimacy feels. Other factors matter too. How quickly your body metabolizes these drugs, your overall cardiovascular health, what other medications you take, and even lifestyle habits like drinking alcohol or eating a heavy meal can influence how effective they are. For men over 50, these considerations become increasingly important because blood flow, metabolism, and heart health naturally change with age. Understanding the science behind how these medications work gives you a clearer picture of why one might suit you better than the other. It's not just marketing, it's about your body, your health, and your lifestyle. Next, I'm going to show you exactly how to make the choice, including practical steps, tips for using them safely, and strategies to maximize effectiveness so you get the results you want. Now that we understand how Viagra and Cialis work in the body, the next question is, which one should you actually choose? The answer depends on your lifestyle, your goals, and your personal health. Let's break it down in a way that makes sense for men over 50 who want results without stress or guesswork. First, consider timing. If you want a medication that works quickly for planned intimacy, Viagra is usually the go-to option. It typically begins to work within 30 to 60 minutes, making it ideal if you know the window when you'll need it. That said, you should take it on an empty stomach if possible because a heavy meal can delay absorption. Think of it as planning a meeting. You want everything lined up so it works right when you need it. On the other hand, if you prefer spontaneity, Cialis is the better option. While it may take a bit longer to kick in, usually about an hour, its effects can last up to 36 hours, giving you flexibility and less pressure. Many men describe it as the difference between a short sprint and having endurance for a whole weekend. Next, dosage matters. Both medications come in multiple strengths. A doctor will help you find the right dose based on your health, age, and response to the drug. Starting too high can increase side effects like headaches, flushing, or dizziness, while too low may not give the effect you want. For men over 50, it's important to start conservatively, especially if you have cardiovascular concerns or take medications like nitrates. Safety comes first. Lifestyle factors also play a role in effectiveness. For example, alcohol can dull the effect of both medications. Heavy meals, particularly those high in fat, can slow absorption, especially for Viagra. On the flip side, regular exercise, maintaining healthy weight, and managing stress can enhance how well these drugs work. Think of the medication as giving your body a boost. If your overall health is optimized, the boost is much stronger and more reliable. Some men even combine medication with natural strategies to maximize results. For example, pelvic floor exercises, often called Kegels, strengthen the muscles that help maintain erections. Regular cardiovascular exercise supports blood flow, which is essential for both Viagra and Cialis to work effectively. Simple adjustments like these can make the difference between moderate success and feeling truly confident in the bedroom. Another important factor is frequency. Viagra is generally taken as needed, so it's best suited for occasional use. Cialis, on the other hand, can be prescribed as a daily low-dose regimen, which is useful for men who want a more natural, spontaneous experience without planning around the clock. Daily Cialis can also provide benefits for prostate health and may improve overall sexual confidence. It's also worth noting how your body tolerates each medication. Some men find one easier on their stomach, while others notice fewer headaches or less flushing with the other. Tracking your experience over several tries is crucial. Keep a simple journal. Note the timing, the dose, any side effects, and how strong the erections felt. Over time, you'll see a pattern that helps you and your doctor make the best choice. Finally, remember that neither medication replaces healthy habits. Both Viagra and Cialis work best when your cardiovascular health, weight, stress levels, and sleep quality are optimized. Think of the pills as tools. They amplify your natural function, but they can't fix poor lifestyle habits. Pairing medication with diet, exercise, and pelvic floor exercises gives you the best chance of consistent, reliable results. With this knowledge, you can make an informed decision based on your schedule, lifestyle, and health profile. But there are still some pitfalls that many men encounter that can reduce effectiveness or even cause problems if ignored. Before you start deciding between Cialis and Viagra, it's important to know the mistakes that can ruin your results. Many men make simple errors that leave them frustrated, thinking the medication doesn't work for them. Don't be that guy. Understanding these pitfalls can save you time, discomfort, and disappointment. The first mistake is timing. Taking Viagra too late after a meal, or taking Cialis at the wrong moment, can make the effects less predictable. For Viagra, eating a heavy, fatty meal can delay absorption, meaning it might take longer to work or feel weaker than expected. Cialis, though longer lasting, is sometimes taken in the wrong dose or without consulting a doctor, which can cause side effects like headaches or flushing. Timing isn't just about convenience, it's about maximizing effectiveness. Another common mistake is ignoring your overall health. Men over 50 often have conditions like high blood pressure, diabetes, or heart issues, which can affect how these medications work. Combining ED medications with nitrates or certain other prescriptions can be dangerous. Always speak with a doctor before starting any medication, even if it's just occasional use. Safety comes first. Some men assume more is better, taking higher doses than recommended. This can increase side effects without improving performance and may even be harmful over time. Stick to the prescribed dose, and remember that it may take a few tries to find what works best for your body. Patience is key. Lifestyle errors also reduce effectiveness. Drinking alcohol excessively before taking the pill, smoking, eating poorly, or being sedentary all impair blood flow and reduce how well the medication works. Think of the pill as a tool. It can only do so much if your body isn't primed to respond. Combining medication with exercise, stress management, and a healthy diet amplifies results. Finally, failing to track your experiences is a missed opportunity. Many men take the medication once or twice and assume it doesn't work, without considering timing, food, or other factors. Keeping a simple journal of dose, timing, meals, and effects can help you and your doctor fine-tune the right approach. Avoid these mistakes, and you'll maximize both safety and effectiveness, giving you the confidence and reliability you're looking for. Let's wrap this up and make it simple. Choosing between Cialis and Viagra doesn't have to feel confusing or intimidating. Both medications are effective for treating erectile dysfunction, but the best choice depends on your lifestyle, your health, and your personal goals. Viagra works fast and is ideal for planned intimacy, while Cialis lasts longer, giving you flexibility and a more spontaneous experience. The right timing, correct dose, and safe use are all critical for getting consistent results. Remember, these medications don't work in isolation. Your overall health matters just as much. Regular exercise, a balanced diet, stress management, and even pelvic floor exercises can dramatically improve how these drugs work. Think of the medication as a powerful tool that amplifies your natural function. The stronger and healthier your body, the better the results. Tracking your experiences, dose, timing, meals, and effects helps you find the right routine and ensures you're not guessing in the dark. Now here's a simple challenge for you. Over the next month, if you're planning to use either Viagra or Cialis, take note of exactly when you take it, how long it takes to work, and how strong your results feel. Try pairing it with a small lifestyle adjustment, like a 20-minute walk or pelvic floor exercises. After 4 weeks, you'll have a clear picture of what works best for your body and lifestyle. I also want to hear from you. Have you tried either of these medications before? And if so, what was your experience? Drop a comment below. Your insight might help other men make informed choices. If this video gave you clarity and confidence, make sure to like it, share it with someone who might benefit, and subscribe to the channel for more science-backed strategies for men over 50. Save this video so you can revisit it whenever you need guidance, and take control of your health and performance starting today. Your confidence, stamina, and vitality are worth it.